Have you ever really thought about what goes on during a tooth extraction? I mean, it's way more than just a simple pull. There's this whole fascinating mix of medicine, safety protocols, and even some basic physics going on. So today, we're going to take these pretty dense medical notes and turn them into a clear, straightforward guide to exodontia. You know, getting a tooth pulled. So here's our game plan. We'll start with why a tooth might need to come out in the first place. Then, we'll get into the super important safety checks, take a peek at the dentist's toolkit, uncover the surprisingly simple physics that make it all work, and finally, we'll talk about what happens after to make sure everything heals up just right. All right, let's dive right in. First things first, under what circumstances does a dentist decide that a tooth actually has to go? So the official medical term is exodontia. And this definition from Jeffrey L. Ho is pretty much perfect. You gotta love the keywords here. Painless, minimal trauma, and heals uneventfully. That's the goal, right? It shows you it's meant to be a delicate, precise procedure. Okay, so that definition sets a pretty high bar. But what are the real-world reasons that make a dentist look at a tooth and say, yep, that one's gotta come out? Well, it turns out there's a whole list of reasons. It could be a really bad cavity that's just too far gone to fix, or serious gum disease. Sometimes teeth get impacted. You know, they're stuck and can't come in right. That's the classic wisdom tooth problem. Other times, it's a fractured tooth, or someone might even have extra teeth. And sometimes, you just need to make space for something like braces. So once the decision is made, the dentist can't just jump right in. Nope. The next step is a really critical safety check to make sure the patient is actually ready for the procedure. And the answer to that, it's a definite no. There are a bunch of red flags, they call them contraindications, that tell a dentist to hit the brakes, maybe call the patient's doctor, or even postpone the whole thing. Some of these red flags are systemic, which just means they affect your whole body. For instance, if a patient has uncontrolled diabetes, healing can be a real problem. Or someone with a serious heart condition, well, the stress of the procedure could be risky. Even pregnancy is a factor. Usually, the second trimester is the safest window if an extraction is absolutely necessary. Then you've got local issues, problems right there in the mouth. If someone's had radiation therapy for cancer in their jaw, for example, the bone doesn't heal as well, which can cause major complications. And you'd never want to pull a tooth that's inside a tumor. Even a bad infection, like an abscess, has to be brought under control with antibiotics first, so it doesn't spread once the tooth is out. Okay, so the patient has gotten the green light. What's the dentist actually going to use? Let's take a look at the armamentarium, which sounds super intense, I know, but it's just the fancy name for the toolkit. Ah, yes, the one tool everybody recognizes, the forceps. But look at it. The design is just genius in its simplicity. You've got the handles where the dentist applies force, the hinge that acts as the pivot point, and the beak, which is shaped perfectly to get a solid grip on the tooth. But wait, before the forceps even come into play, there's another hero tool that does a lot of the initial work, the dental elevator. And its job is absolutely crucial. It's used to gently loosen the tooth from the bone, creating space and making the final removal way easier and less traumatic. And how it works? Well, that's pure physics. And this brings us to what I think is the coolest part of this whole thing. A successful extraction isn't about brute strength. Not at all. It's about the clever application of some really simple physics. Exactly. So you can forget that old cartoon image of a dentist with a foot on the patient's chest, yanking with all their might. A modern dentist is basically acting like an engineer, using mechanical advantage to turn a small, controlled movement into a powerful, effective force. It's all about strategy. Okay, so the first big idea here is the lever principle. And you already know this one from everyday life. Think about a seesaw or using a crowbar to pry something open. You apply a little bit of force on the long end, and you get a huge amount of power on the short end. That's a lever. And those forceps we just saw, they are a perfect example of a class 1 lever. The dentist squeeze on the handles, that's the effort. The hinge in the middle, that's the fulcrum or pivot point. And the load, well, that's the tooth. This simple machine multiplies the force the dentist is applying. Pretty smart, right? All right, the second key principle is the wedge. Again, super simple. Think of an axe splitting a log, or even just a doorstop. You push it forward into a tiny crack, and it creates this powerful separating force, pushing out to the sides. And that is exactly what a dental elevator does. It's a wedge. The dentist carefully inserts it into the space between the tooth root and the bone. As they apply a little pressure, the wedge shape starts to expand the socket and sever the tiny ligaments holding the tooth. This whole loosening process is called luxation. So if we put it all together, the procedure looks something like this. First, you get numb. That's a given. Then the dentist loosens the gum tissue. In comes the elevator, our wedge, to start loosening the tooth. After that, the forceps, our lever, get a firm grip, and with a few careful movements, the tooth is finally removed from the socket. Okay, the tooth is out. Success! But the journey isn't quite over. Now comes the really important phase, proper healing and making sure there are no complications. And following these post-op instructions is absolutely everything. Remember that uneventful healing we talked about at the beginning? This is how you get it. Biting on gauze helps a crucial blood clot to form, ice packs keep the swelling down, and being really gentle for the first 24 hours is key. And the main reason you have to be so careful is to avoid this, a dry socket. It's the most common and painful complication. And the weird thing is, the pain doesn't hit right away. It usually kicks in a few days later, and let me tell you, it can be really intense. So here's what's going on. After the tooth comes out, your body's first job is to form a blood clot in the empty socket. The best way to think about it is like a natural scab forming over a wound. It's a protective barrier for the bone and nerves underneath, and it's the foundation for new tissue to grow. But if that clot gets dislodged too early, maybe from drinking through a straw, rinsing too hard, or smoking, then it's gone. And all of a sudden, that sensitive bone and those raw nerve endings are exposed to air, food, liquids, everything. That exposure is what causes the awful pain of a dry socket. It's literally like ripping a scab off a wound before it's had a chance to heal. So, from the initial diagnosis all the way to healing, a tooth extraction is this carefully managed process that's grounded in both biology and physics. It's pretty amazing when you think about it. If the simple high school physics of a lever and a wedge are this important here, it really makes you wonder, right? What other fundamental laws of science are hiding in plain sight in other medical procedures?